Pain isn't fun, right? I know a lot of people are scared of the pain of labor. So today I'm going to give you 4 things to know about the pain of labor that hopefully help you feel a little bit better about your upcoming birth. In case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I get being afraid of pain. My appendix just ruptured last fall, and pain is not fun. I honestly hadn't felt that much pain probably since I was in labor, so I get it. While we're here, please give this video a like. It's going to help you get better pregnancy content into your feed, as well as tell other people that this is high quality pregnancy content that they can rely on. And give me a follow. I'd love to hang with you for the rest of your pregnancy. This video is sponsored by the Online Prenatal Class for couples. It truly is the easy way to get prepared for birth. It can be done under 3 hours, easily on your couch. Just make sure you bring the snacks. Check it out. As a note, we are talking about term labor pain and also labor pains. I'm not talking about pregnancy pains. If your hips or something are hurting, that is a totally different thing. This video is not about that. And this video has a partner article that has more information if you're interested. Okay, sometimes when I hear that pain is the thing that people are most preparing for about labor or the most afraid of, I think that is anxiety that is wasted. Because if you get to the hospital and you're in a lot of pain and you want something, they can give you something. There are 3 medications that they can give for pain in most hospitals. There is IV pain medication. This is the unsung hero. If you are just wanting to relax and you just think you need just like a little bit of something to get there, IV pain medicine can be awesome. There is the epidural, which is what most people in the United States choose. And there is nitrous oxide, which I think is pretty similar to IV pain medication as far as kind of just helping you relax and so your cervix can dilate. Not all hospitals offer nitrous oxide, so check with your hospital to make sure they do before you plan on that one. Now, I get if you want to avoid the epidural. I totally get that. But we got to take everything in the baby steps and the steps in which they come. If you get to the hospital and the pain is overwhelming you, there are things available there for you, and that should be comforting to you. So I wouldn't be so worried about pain. I definitely wouldn't make it your #1 priority in birth preparation. I think there's a lot more things to look at. We're going to talk more about that, but there's something that can help you out. Nurses are real good at taking pain away. That's one of our best things. Really quick, I know a lot of you might be thinking, I'm getting an epidural, so I probably don't even need a birth class. I don't need to learn the pain management options out there. Wrong. I think a birth class, first of all, should include some natural pain management options. You're gonna need some breathing techniques to get you to that epidural if that's what you so choose. Plus, you might need it even for some of those Braxton Hicks you have later in pregnancy. Also, a good birth class is really going to prepare you for a lot more than just pain. It's going to help prepare you to know what's going to happen, how to make choices for yourself, the different interventions, the different options you have. It is really important to still take a birth class, even if you're planning on an epidural. Okay, the second thing to know about this type of pain is that it is helpful pain. Now, I told you that my appendix ruptured last fall, and when you have pain in your body, let's say you've broken a bone or your appendix ruptured, that pain is there to help you know that you need to go get help, right? It was excruciating amounts of pain. In labor, the pain that you're experiencing is meant to be there. Your uterus is saying, this baby is getting too big. It is time to get it out before we explode. And so it starts compressing to help baby come out of the womb. And that's what the pain is. You know what it is. And so it's helpful pain. It's really important that this baby get out before you explode, because I know you've probably felt like you're going to explode if you're in those last few weeks of pregnancy. Remember, when you go into labor, there are 3 things that are agreeing. Your mind is agreeing, because obviously our ancestors didn't want to go into labor while they were running from a bear, right? So you want to be in a peaceful situation most often. The baby needs to say it's okay. There's something in the baby that says, yep, everything's formed. We can get out of here. And then the third thing is that your uterus is so big, it needs to get the baby out before it explodes. So those are the 3 things that need to agree in order for you to go into labor. Of course, these things don't always happen according to plan, but that's what we're hoping for. That's what Mother Nature designed it for. Preterm labor, things like that. What can you do? And again, if you are before 36, 37 weeks and you're having these types of pain, that is not helpful pain. We want to keep that baby inside as much longer as we can. So that's something you definitely need to talk with your provider about. Okay, the third thing that you need to know about labor pains is that you have to relax into it. Now, this is sort of unusual. If you break your arm, you're not thinking, oh, I need to relax into my broken arm pain, right? No, you're thinking, oh my gosh, my arm hurts so bad. Let's go to the doctor, right? But with labor pain, this cervix here is part of your body. And if your whole body is tensed up, this cervix is going to be like, nah, we not opening either. We going to tense up. And so the more that you can relax and just let this uterus do its job, the better off you're going to be. Now, there are two things that I think can really help you with this. The first one is practice opening that pelvic floor. When I did prenatal yoga, a lot of times they would get us in a deep squat, which by the way, I always use my couch behind me because I am not a great deep squatter. And we would work on just relaxing that pelvic floor. And if you're sitting there thinking, what the heck does that even feel like? That is when you go to pee, right? The rest of the time, you kind of got a handle on your pelvic floor. But when you go to pee, you relax all those muscles so that it can flow. And learning to relax those muscles as well as squatting, because squatting can be really helpful too. I talk about that all the time on this channel. It really helps so the baby can come down. And I got to say, there's a lot of people that don't know how to fully relax it. I'll see them pushing and all of a sudden they're doing a Kegel, and that's not helping. We got to keep everything relaxed down there. So the more you can learn to relax that pelvic floor, the better off you're going to be. The second thing is to learn breathing techniques. So let's quickly go through one. Now, I do a lot more in the online prenatal class for couples, but the one that we talk about most often are the he's and the who's. So right? So in the he's, you're breathing in, and the who's, you're breathing out. Now, as you do that with me, let's do it together. I want you to notice your pelvic floor. Do you have it clenched when you're doing that? No, when you're doing deep breathing, a lot of times your pelvic floor just disengages. And so I think that those things, first off, like you can do 4 he's and 2 who's, and it just gives you something else to concentrate on rather than the pain. Plus that breathing helps that pelvic floor to really relax into the pain. And so that's why learning breathing techniques can be super helpful. Come join me in the online prenatal class for couples where we go over things like that in the natural pain management bonus video. In fact, it includes not only breathing, it also includes other types of natural pain management that you can try at home, including a tennis or a racquetball, so that you and your partner can feel informed about the natural pain management options that are available to you. Number 4 is that preparation is the key. A lot of times I had a patient once come to me and she goes, Hilary, this is hurting very badly. And I was like, yeah. And she was like, I didn't know that it was going to hurt. And I was like, oh my gosh, like I wanted to give her a hug. I just didn't know what to do. I couldn't believe that somebody got all the way to labor and had no idea that it was going to be painful. You got to know being prepared to know that, one, this pain is normal. She was scared of the pain because she thought something was seriously wrong. And that is the worst. So educating her helped a lot. Knowing your different pain management options, as well as natural pain management techniques that can help you to relax. Now, some of you might be thinking, I'm getting an epidural. I don't need natural pain management techniques at all. But the epidural is really only meant to take away about 80% of the pain. And so you're looking to have 20% of some discomfort that can help you both turn better in the bed, but also kind of feel things and know when it's time for you to push and to feel better as you push. So having those natural breathing techniques can really help you during that phase as well. A lot of people think they want their epidural to completely numb them, and I'm here to tell you that that is not going to be helpful. So you want to look for that 80% epidural so that you still have some movement and some feeling. The other thing is that the hospital is just a scary place. Some people get freaked out by the admission, and I understand. There are so many questions. They're asking for money, all these different kinds of things. What about if 5 nurses run in your room because they say the baby's heart rate is down? If you know that those types of things are normal, it really helps that not add to the pain that you're already having. So being prepared, feeling confident can really help you as you go into the labor room so you're not piling your scaredness on top of the pain. The thing I see really often is people actually requesting a C-section because they didn't sleep or manage early labor well at home, or they had no idea how long their induction was going to be, and they're just miserable by the end, or they just can't cope with all these fears that are constantly coming at them at the hospital. They're just unprepared, and I don't want that for you. So make sure that you get prepared for birth and pain management. The good news is that you can use code PAIN MANAGEMENT to get $20 off the online prenatal class for couples if you start today. I think it's a great time to get started. If you're wondering if you're too early, I usually recommend buying it before 20 weeks and then getting started a little bit after 20 weeks. Okay, what other questions do you have about pain and labor? Ask me in the comments so that I can address them in a later video. And I hope that you'll like some of these next videos as well.